So are we still trying to figure out this
A peresekanii.
Peresekanii?
I'm Dr. Maxine Wong.
Clarissa, a registered massage therapist.
And sometimes when we're in clinic together, we try to look up information and further our skills. So today we're looking at a bunch of different manual techniques, and then we ran into a bunch of ones that we didn't know and started to challenge our knowledge of anatomy. So we have found
Peresekanii, which is described as produced radial edges of the brush at the maximum retracted thumb when peresekanii produced with one hand, brush pushing the edge of the beam, making rhythmic movements by themselves in the direction of the index finger, and to itself in the direction of the thumb. When you receive two hands, the brushing massage therapist should be facing each other or back surface located at a distance 2 to 3 centimeters. I'm going to leave it at that because...
Okay, so the first issue we came up with, it said at a maximum retracted thumb, and I don't believe the thumb actually does any retraction. No. So the movements of the thumb as a bit of a review. So our thumb, we have this fun little saddle joint here between the first metacarpal the first metacarpal and the trapezium. So it's a saddle joint, basically. It looks kind of like a Pringle or a saddle, and it allows it to move like this, and like this, and also like this. So we know that, so I taught this to my students a little earlier. So there's flexion, so I'm curling the thumb in. There's extension, where I'm moving my thumb away. And then if you want to look at abduction and adduction, so abduction, which is moving away from the midline, and then you also have adduction, moving towards the midline, and then we also have opposition, which is when you're trying to pull your thumb and your pinky together, and then we were trying to retract our thumbs, but we're like, what are we doing?
So maybe by retract they mean extend.
Even though thumb retraction doesn't, you can't, that's the combination of flexion and flexion and mostly just flexion.
So if maybe we think about the direction of the hand being placed onto a body, right, which would be, say, the body is right in front of us, I would think they mean extension, right? Yeah, extension. And then they're talking about it being brought towards the index finger, right?
So it's
circular motion maybe with the thumb from an extended to...
Okay, so it makes sense to talk about that radial edge. So again, it says produced radial edge of the brush at the maximum retracted, or I guess extended thumb. When it's produced with one hand brush, pushing the edge of the beam, making rhythmic movements by themselves in the direction of the index finger, and then to itself in the direction. So maybe it's...
Yeah,
that.
because...
So...
Maybe like that.
Yeah. So I guess that's if you're massaging someone's shoulders, right? You usually do that.
To give more context, it says used in massage, limbs, cervical spine, and the trapezius muscle group, the abdomen muscle. So if it's used on the trapezius, I'm assuming it's talking about this action.
That would make sense. How would you use it on the abdomen, though? Is it
I would assume on the side of the abdomen, so kind of coming together in alternating fashion, so which we would call a C-need.
Okay. All right. So...
Mystery solved? Maybe?
I guess we learned something. So yeah, the next time we figure something else out, or maybe if we don't figure something else out, or if someone out there in the world knows what it actually is and can coherently describe it, that'd be rad.
Yeah.
Okay.
Awesome.
Cool. Let's high five on that.
Yeah.
Anyway.